There are 5 ligaments in this area, but there are 3 that comprise the majority of pathology. The most common, moving anterior, is the anterior talofibular ligament. That tears in isolation or in combination with the calcaneofibular ligament in about 88% of the population. So that's my first step, starting first with the anterior talofibular ligament. If I simply look at the patient and palpate the distal fibula, that will be my starting point. So here's the distal fibula. I'll put the transducer in the axial plane, somewhat parallel to the plantar surface of the foot. And here what we'll see is the fibula on the left, the talus on the right, and here's the normal anterior talofibular ligament. A little bit of joint fluid here, just a little bit more than physiologic over here, and there's the talus on the right. So that is the first ligament. Again, that is the ligament that's torn most commonly. Now, one pitfall is if you're too proximal, let's say you're like up here, it could look like the ligament is gone, like a chronic tear. The key to know that we're in the wrong location is we can see the hyaline cartilage of the talus. We're too high. So the idea here is always err on going distal. So if you don't see the ligament, keep moving the transducer more distally, like this. And even when you come off the fibula like that, then just back up a little bit. That is where you're going to see the anterior talofibular ligament.